Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hello friends, let us now learn some important points about typical, like it's just a small differences. Typical or first generation antipsychotic with atypical antipsychotic. Like if you see typical and first generation and antipsychotic, here the mechanism is post-synaptic D2 blockade, whereas in atypical antipsychotic it is caused by 5-HT2 receptor blockade. Okay, so if you see the examples of first generation are we will learn examples in the next class. Okay, thank you for watching.
thank you and thank you for watching.